A brand new show that just dropped. While the presenters play dominoes, a special guest will be discussing all topics that matter to you. Everything from judicial, legal, health, wealth. Nothing is off topic. The name you ask me? Domino Effect. Domino Effect. Come listen. It's time well spent.
Good morning, good afternoon, and good evening. Whatever time of the day you're watching the show, this is the Domino Effect Show. If this is the first time you're watching the show, this is how it's operate. I, the Padre, we're gonna play dominoes with a special guest, and this is how it works. This is my friend Eve. This is Sweet Will. Today we have Nurse Pat on the table. We're gonna talk about a special topic that is mostly related to men. So I know you guys gonna have a very good, a very funny time with this topic. And I don't know if Nurse Pat gonna enjoy this, but I figured I would bring this subject because a lot of Haitian men have issues with that. So, Nurse Pat, what subject? It's urology.
Oh,
So, urology. For those of you guys don't realize
not too sensitive to people.
No, man, I'm sorry, but
Wait, why would you say it's a sensitive topic?
Because our culture, when people talk about,
Wait, do you even know what a urologist is?
yeah,
So what's a urologist?
we're gonna check about our balls.
Really? No. All right. For those of you watching us, a urologist is a specialist.
Yeah,
Not only, since Eve's brought this up, urologists don't only deal with balls, as he mentioned, but urologists deal with everything that have to do with the urinary system,
yeah.
treating both men and women. Urologists are not only physicians, but they are also surgeons. So urologists deal with infertility in men. They deal with urinary tract problems. They deal with impotence. They deal with incontinence.
wait. What kind of word is that?
Impotence?
No, the other word you just.
Incontinence?
What's that?
Okay, incontinence is what
For
happens
wait.
when...
Okay, for regular English people like me, what does that mean?
Who just played?
I just played.
Okay, so incontinence refers to being unable to hold your urine, meaning you're peeing on yourself.
Oh,
You're
that
okay.
means
unable.
you keep wearing diapers.
No, no. Okay. So, do you know sometimes pregnant women, with the pressure that the baby puts on their bladder, they can have moments of incontinence?
Oh,
Oh, okay. We didn't know
And
that.
men who have prostate cancer can have moments of incontinence. And there are certain diseases that cause your bladder to weaken. Sometimes women, after having so many children, their bladder can be weakened, so they can have an issue with incontinence where they tell them to do certain exercises to kind of like strengthen their bladders. So incontinence can happen to anybody and to everybody. Like bedwetting is called enuresis, but it's a type of
are you talking
incontinence.
about the night?
When the children, when they were little, and
Oh.
they would have periods of incontinence. So it's not
So
a
wait,
tumor.
Sweet Will, how come you only have 4 and I got 5?
Cause he's
I
the
have
one that
five.
come out.
He started.
Oh, okay. So you
He
get that's your
started.
turn.
So it's your turn. So urologists do a lot more than just
Play with
talking
your
about balls or
But-
your testicles.
On
as
2
we were
days, we're
talking
gonna
about
talk
it.
about testicles.
No, today we're going to discuss.
Okay, you guys pass.
Wait. Yeah, I did. Go ahead.
I said all you guys pass.
But you hadn't played that yet.
Okay,
Jose,
I'm
you
playing
don't
now.
have to- you don't
Go
have to-
ahead.
Okay,
Go
I'm
ahead.
playing now.
So today we're going to address urology in the terms that it affects men.
Okay.
That's so I
So
did
okay,
that.
so okay, before you start,
Mhm.
You
okay,
have-
I know we all of us here are all of us here.
As well.
Yeah.
Okay, okay. Did you play that?
I
show?
did. I passed, and he.
Oh, you passed.
Yeah. And
So
he
wait.
won. Exactly.
Oh,
You
my
did
bad.
This. You done
So
did this.
okay, my bad. Well, okay, so okay. I know you guys are. I mean,
Well.
between the three of us here, we are of a certain age. When was the last time you guys went to see a doctor for a prostate
You
check?
mean checking your balls?
No,
No.
I said a doctor to
Oh.
check your prostate.
Check.
I didn't ask you when was the last time you checked your balls. I asked you when was the last time you went to see a
prostate.
doctor to check your prostate.
That's a good question. I have a physical coming up,
Okay.
but I don't let anybody check my balls. That's it.
Not your balls. Your prostate has nothing to do with
not-
your balls.
It's not
Okay,
in
see?
it's not-
The prostate gland is not located anywhere near your testes
Oh
or
my
your
God.
testicles or your
See?
so
It's in your butt.
So your
it's
turn.
it's in your rectum.
Oh no! That's terrible. I won't let anybody go there.
But they have to because the doctor just basically takes his fingers, he lubricates them, and he goes
Oh
in.
my
No,
God.
may I finish? What he's doing when he does that is he's checking for the size of it. Because if it feels abnormal, if the surface of it isn't smooth like how it's supposed to, that's an abnormality. If the size of it feels off, that's an abnormality. And that may be an indication of prostate cancer. So a lot of men will turn around and say, oh, and I'm going to say, since we said we were doing this in Kringlish, they're going to say, oh, Dr. Atebam duet. The doctor turned around and gave me the finger. No, he's checking your prostate. That's part of his job. He's supposed to do that to ensure that you're in good health.
Good to know.
So wait. So does that mean does that mean when the
Yes.
doctor?
Yes.
Yeah,
So,
they-
so,
There is-
so when
I've
the
had
is that
that
the
done.
PSA?
No, the PSA, that's the prostate surface antigen.
Don't they
That's
do it at a certain
Ho-
age?
ho- yes, they do. However, they may do it earlier. Like in my family, there are some of the men who have had a history of prostate cancer. So when you do, the doctors may opt to start checking you at a younger age just to make sure that you're okay. And just to make sure, especially if you have a family history, okay? In terms of prostate cancer, one of the things you guys should know, and that's one of the reasons why the Padre wanted to bring this today, Black men are at a higher risk of prostate cancer than white men. Also, Black men who have a family history of prostate cancer, as well as a family history of women with breast cancer, are at a higher risk of prostate cancer as well.
Okay. Now,
But let me circle back. You asked about the test. There is a test called the PSA test. That's the prostate surface antigen test. They check those levels. If you are at risk, it's a blood test. They check those levels to see there's normal levels and there's elevated levels. When you have elevated levels, what they can turn around and do is to turn around and say, okay, your levels are elevated. So what we are going to do is we are going to get further testing. We're going to send you to get some imaging to see what your prostate looks like, because your levels could be high and your prostate could look fine.
early when we're starting the show, we asked a question: what is a
urologist? Yeah.
Urologist, and I said checking
Your balls. That's
checking
not all
balls.
they do.
So
Yeah.
that's not all they do.
So now I kind of have
A better
You have a better idea,
understanding.
better understanding what they do.
But my question: why did checking? What's got the when they're checking the prostate? They have to go to my anal.
Because that's where the prostate gland, that's the best way to get to it. They can't go through your penis because you see the little hole at the, how they're gonna go through there to be able to get to where the prostate gland is. I did tell the Padre today that I wasn't going to bring my big anatomy and physiology chart to show you where that gland
That would
sits.
be great.
No, I did not want to scare anybody. I do have the chart. I could have brought it, but I opted not to do that. But if we're discussing prostate cancer, which is what we're going to discuss, like I said, black men are high risk for this, very high risk for this. And the thing is, it affects when you're looking at the risk factors, it affects men of a certain age. So the older you are, the more at risk you are. Also, another thing, another way that it affects you, your weight. If you're obese, your diet. If you have a family history of this, if you have a maternal family history of breast cancer, if you have a positive BRCA gene, the BRCA gene, those are certain cancer genes that they do a blood test, a simple blood test. If you come back positive for certain BRCA genes, that would tell you if you're predisposed for certain cancers. So when those come back, that could predispose you for prostate cancer. So when you're looking at it, it's very common because they could say that it would be, let's see, compared to certain other cancers, more than 3 million US cases every year of prostate cancer. But it is treatable because there are different stages. There are stages such as it could start as level 0 and then go to stage 4. Stage 4 means that it can metastasize to other areas in your body. By saying metastasize, it can spread to other parts of your body. So this is something that's very serious.
Okay. When a prostate cancer, is that the same thing as since we say we doing Quenglish? Is that the same thing that when they say you have makuklu?
No.
Oh,
No,
okay.
it's not. It's not. So when they're talking about ugemakuku, that can happen when you have a swelling of the testicles in your groin area, like legit. That's what we're doing. That's when. But when you're looking at it though, makuku can be a predisposition of testicular cancer.
So how common is testicular cancer?
Okay, so since we're leaving prostate cancer and we're going to testicular cancer,
Well, because
we'll go back to it.
Yeah,
we'll
but you just brought it up, so I figured out. Man, I didn't come to play.
Testicular cancer. You pass. So testicular cancer affects, believe it or not, it starts in adolescent. So it affects children from age 15 to about age 40. It's very rare. There's about like 20,000 cases. Let's see, what was that? There's like 20,000 cases in the US every year. Okay?
Wait.
I
Patricia put
passed.
that, he jumped the gun.
Oh, okay.
Yeah.
So there.
So that's your turn.
That's you.
So with testicular cancer, there's you don't know what
Patricia, go ahead and win.
you
Oh, how many times you passed?
No, yeah, exactly.
Yeah, that's
so
right.
with testicular cancer, there are no signs and symptoms for the early stages of testicular cancer. Since you're talking about the balls, it's all about the balls with testicular cancer.
Yeah.
Okay. Do you guys do testicular self-checks?
What do you mean by that?
You yourself.
yourself?
What do I mean by that?
Yeah.
Okay, first of all, First
Go
of
ahead.
all, Miss
Go
Pat,
ahead.
you're asking these Christian boys a question that is very hard to do.
Don't make me laugh. Don't make me laugh. Come on.
Saying.
Come
Okay?
on, guys. Okay,
I'm
let's be
just
real.
saying. Okay.
Unpa by Muncie. Y'all are Christian men. Unpa by Muncie. How many of you, when you're sitting there watching the TV, you got one hand in your pants and you're watching the TV and you're just sitting there playing with your balls?
You did
I
that?
ain't gonna lie. I watch TV and my hands in there. I ain't gonna lie.
It's mine.
Yeah.
Exactly. So
I have no idea
simple.
about ball.
Okay.
But your hand is not in your pants while you watching TV.
When it's cold.
Okay.
Regardless
if
hand-
it's cold or hot, regardless what the temperature. What the question was,
When you're sitting there watching TV and your hands in your pants, you're touching your balls and you're just watching TV, you're chilling.
Oh yeah, sometimes I squeeze it.
Okay. All right. So that means she's telling you
So
that.
I'm telling you, you do that. So okay,
Your
this
turn,
is
Philip.
this is what the urologist. Oh, cause I won. This is what the urologist recommends. Okay, it's recommended that once a month, when you're in the shower. The reason why they say in the shower is because the warmth of the shower. I can put down anything because I don't have a double. The warmth of the shower will help not only relax you, but it will make it easier. So while you're in the shower, you're taking a shower, the water's falling on you, you would take your left hand and take your left testicle. Okay?
Nurse Pat,
Yes.
you're really encouraging some very bad
That's not bad
some
behavior.
bad behavior here.
Excuse me, I'm not telling them to pleasure themselves. I'm telling them to check their balls for cancer.
Left hand, left balls.
Left hand, left ball. You have the left hand, you're taking your thumb, you're putting it at the top of the ball, okay? The testicle.
So just one ball.
One ball. And then the rest of the fingers are around it, and you're going around it in a circular motion because what you're making sure it feels smooth. It doesn't hurt. It isn't swollen. There aren't any bumps, and it doesn't feel tight or restricted to the touch. You heard all that?
Yes.
I heard, but that's a lot of info. How you gonna? If I'm not a doctor, I don't know when it's a normal.
Well, you
feeling.
can definitely go online to urology.com, to webmd.com, and put down how to perform a testicular exam on yourself. Self-testicular exam, okay? So once you've done that to the left one, you will take your hand.
Doctors used to do that when you were kids. Now they
Yes.
don't do that anymore.
Yeah, they don't do that. Maybe too much. Too much
Lawsuits.
incident.
All right, I'm gonna be
because
like, listen.
Maybe
you
too
check
much
this.
incident. Now, rolling
So
balls.
let me finish. So once you've done that to the left, you'll go and do that to the right, okay? Sometimes you can find some bumps. You would report that to your doctor, any abnormality. What you shouldn't feel any pulling. You shouldn't feel any pain, okay? If you feel some bumps or anything that feels abnormal, if one is bigger than the other, you should definitely give your doctor a call because any abnormality needs to be reported. Now, if this is something you've never done before, definitely start doing it once a month and report back to your doctor. Because testicular cancer, though it's more common in white men, but it does affect our community. Because sometimes we have children when they were born, their testicles didn't fully drop. So they had undescended testes. One dropped, the other one didn't. So they had to have surgical intervention to descend the other testicle. And at times that can put them at risk for testicular cancer. Another thing, this trend that these young men have nowadays, where they're wearing, I have 5, where they're wearing these tight jeans. Yeah, no, that's not a very good idea.
Let it loose.
Let it hang loose because you need
Boxers. You should be wearing boxers.
You should be wearing. And now I have nothing against tidy whities, everybody. However, it's best to wear something that's comfortable, that's not keeping you restricted, so that they can have room to descend and just hang free and low. Okay? Because some of the signs in early stages of testicular cancer can be painful urination. It can be when you're like, here you are, you could be peeing some blood. You could be having some pain. You could be having some swelling. So there are different things that can happen at that stage.
When you're talking about testicular cancer, so why are different like weather-wise type? Like when it's cold or it's hot out.
They shrink.
He's talking about shrinkage.
They can shrink on you.
Sometimes it feels like you're losing your balls.
He's talking about shrinkage.
Well, here's the thing. If both of them are shrunken, that's okay. But if you have one that's shrunken and one that's swollen, that's a problem. You need to report it to your doctor because that's abnormal. If both of them shrink, it's
weird.
because
He looks like, oh man, I think one of them shrunk last night. because it got colder last night.
So if you're having like a groin, and that's why I said when you brought up the makuklu thing, if you have like a scrotal heaviness or fluid in your groin and some swelling in your groin, you definitely need to report it. If you have lymph nodes, lymph nodes, if your lymph nodes in your groin are swollen, that could mean a sign of infection. It could mean, something. Because one of the things that we don't take into account as parents and also as parents to young men is having this conversation with them. Because I remember one time, my son came to me. Is it my turn?
Yes.
I passed. My son came to me and it was like first thing in the morning. And he came to me innocently because that's the type of kid he is. It was like, hey, mommy, when I wake up in the morning, my pee-pee is hard. And I was like, okay. I said, yeah, that happens. I said, but I think that that's a conversation you need to have with daddy because mommy doesn't have a pee-pee. I'm like, you definitely need
But
to
it
have
is
that
a good.
conversation.
It is said that is a good sign that if you get up in the morning, you get a good wood. That means you're healthy.
Okay, yeah. I didn't prepare that
I'm just
that
saying.
part of the presentation.
I'm just saying because that's what I
I
said
mean,
to
I
him.
don't know. Yeah,
when he came to
you
me.
had that conversation with him.
So,
So
talking about the testicular cancer and stuff, and we're not gonna leave the subject about the.
oh no, we won't.
About
Was
prostate.
that you or was that you?
Yeah, that's just
Oh no,
me.
we're gonna
But
go.
what-
We're
yeah,
gonna go
we're
back
gonna
to
go there. So
prostate.
what- okay.
What I was gonna say, some people when they have to go to the bathroom, like peeing, going to peeing, and
I'm glad you're bringing that up.
It's hard for the peeing
For
to
them
come
to
out.
start.
Yeah.
So if you're having issues starting a stream of urine, if you're having an issue with the force of your stream of urine isn't strong, if you're having issues with dribbling while you're urinating, if you're having issues,
like not dribbling,
if you're
You don't play
having
basketball. You don't know what
he would know. Okay, I'm
so
sorry.
if you're having issues where it hurts to pee, if you're having issues, there's blood in your urine, it feels funny when you urinate, then definitely that's a conversation that you need to have with your doctor because it could mean signs of different things. Dribbling, having pain with the urine, that could mean, or needing to go all the time but not really going too much.
And then if you're
That
not
could mean
drinking,
you
so-
have an infection.
Okay.
You could have an infection. So all of these things you can discuss with your primary care provider who can run some tests. And if the tests are inconclusive, your doctor can then refer you to go and see a urologist.
Okay, so what are some prevention that can be
That's
done?
the important part.
That can be done for testicular.
Unfortunately, there's one of the things that we can definitely say is for prevention, it's education. Education is like the best thing that we can do. We can educate our young men and let them know what to do and where to go. Because there's nothing that you can prevent. You can talk to them about the clothes that they wear, make sure that they're living a healthy lifestyle, but it's kind of hard to prevent a lot of different things, especially when you're not sure about the risk. Legit? What you got?
Oh.
That's two, sir.
Wow.
So, tu brute. That's two. That's two for today.
So you cannot prevent
Testicular cancer, no.
and prostate cancer.
Well, prostate
so
cancer, we
we-
can talk. We're staying on testicular cancer
And
for
then
the
let's
moment.
go- Okay, so
So, like I said, some of the risk factors are the undescended testicles that we talked about, a family history, being young, and that's why I said education, talking to the young men and telling them, these are some of the risks. If you feel some of these symptoms, tell your parents so that they can take you to the doctor and the doctor can take a look and make sure that everything is okay. And then, one thing that cannot be changed, if you're white, definitely you're definitely at risk. Now I have a question for you guys. So one of the things that I know urologists have to deal with, and they deal with people later on in life related to that, is that um, some men come to them asking to be circumcised. Now, circumcision is something that is personal, that is private. And I know as Christian men, we see it a lot in the Bible. So circumcision typically happens for medical, for hygienic, for cultural, and for religious purposes. A lot of the times, what people don't understand is that circumcision also happens and as a way to protect women as well, because with circumcision, you have a decreased risk of the woman coming up and having cervical cancer because it decreases their risk, but also it decreases the risk of the man and the woman of catching certain types of sexually transmitted infections, sexually transmitted diseases. So one of the things that, but circumcision at an older age is actually more difficult and more painful and very risky. So that's one of the things that a lot of urologists do. And another thing that urologists do that we didn't talk about, we have yet to address, is that they also do vasectomies. So a lot of men who have decided with their wives that, hey, you know, I do not, that was me. I do not need to have any more children. So they go ahead and have vasectomies. So they take care of that as well.
You said that's a risk. That's a
No.
risk?
I'm saying that's no. I'm saying urologists do that too.
So, urologists
No.
do that too.
I'm
I'm
just
about to
saying.
say, I'm
I'm
like,
saying
yo.
some of the roles that they play, some of the
Alright, I'm like,
because
yo.
I did not bring it up, so I wanted to bring that up.
So let's go back to
To what?
the
Which one?
prostate.
Okay.
So what are those? I know you were gonna say prevention.
So for the prostate,
It's
I
okay.
actually think that we need to delve deeper into the prostate because it's a longer conversation
Okay.
than what I think we have time for.
Okay.
So, I mean, I don't know, because prostate cancer is it's a lot. It affects our community really, really big. So I think it's a bigger conversation.
Can prostate cancer kill you?
Yes, absolutely. You can die from prostate
Because she
cancer
just
if
said
it's
it
untreated.
spreads. Yeah, it
Because
spreads.
if you have prostate cancer and you haven't gotten treatment, right?
When it's too late to be treated.
If you're at a stage 4.
Oh, I haven't.
Oh,
played.
you haven't played? I'm sorry.
I'm
Oh,
killing
go
double
ahead.
6.
Oh, go
on
ahead.
purpose.
Go kill your
Yeah,
double
you
6.
can go it.
Wow.
Really check his hand. And he goes like,
Go
"Damn."
kill your double
That
6. Yeah. So yeah, you can die from prostate cancer, but you know, these are things that are preventable. And you know, seeing somebody die,
You win.
he wins?
Yeah.
Yes.
Oh.
Double 6.
It's not
Yeah.
close.
Oh,
You
I
win.
win. That's
Yeah,
what
but
I'm
you should
saying.
win.
I win.
Oh, he has double 6.
Oh, you still have another one
No,
in your
no,
hand?
we
Yeah,
don't
but yeah. No,
Then why are you holding
But
it?
I win.
but you should
That's
won.
what I'm saying. I win.
oh.
Come on.
That's 3,
So-
sir. That's
Yes,
3.
Wow. Patricia, she's
That's
the guest,
3.
guys, and she's beating us like that.
No, like Sweet Will said, y'all are being nice to me because I'm bringing information to the
So
table.
prostate cancer,
Yes.
is it you have to be to regard for what we eat or the food that we put in our body that causes it, or is it something genetic?
So, if you are interested in prostate cancer, first of all, if you like the show, please remember to share, subscribe, and like. But if you like this show today and you like everything that you're listening to, please stay tuned and come back for part 2. And we'll be right back as we discuss urology, prostate cancer, and finish up. Thank you so much for watching.
Good night.